News that we are breaking to you at this hour: deaths toll due to Japanese encephalitis in Assam has risen to 94. A National Health Mission bulletin reported in the last 2 days.
The Principal Secretary of the Health Department on Wednesday reviewed the Japanese encephalitis deaths with the district administration as well. Arindam joining us on the phone line. Arindam, if you can take us through the details here. The death toll due to encephalitis seems to be rising in Assam.
Yes, the death toll in Japanese encephalitis cases have gone up to 94 across the state. Actually, this is an annual issue that crops up in Assam because there is every year an outbreak of encephalitis in which a large number of people have to lose their lives. But right now, also several people are admitted in various hospitals across the state with symptoms of Japanese encephalitis. It is the lack of awareness on the part of the people that is leading to this outbreak, because most of the areas where there are cases of Japanese encephalitis are in the remote areas, that is in the tea garden areas, and these people, the tea garden people, are not much aware of Japanese encephalitis. So the initial phase of treatment is very much crucial in Japanese encephalitis, and that is the lack of awareness which is in the minds of the people. So it is the part of the state government to create a much awareness campaign so that no more further deaths or outbreak can be contained.
Right.
So, as I had mentioned, that it is an annual problem that takes place in Assam, but it is the lack of awareness and the lack of campaigning by the Assam government which has led to this outbreak every year.
Absolutely. Local health centers must be activated, health camps must be held. Like you said, Arindam, the initial hours are extremely critical, and if we lose time, especially in getting people out from the rural areas to the city, to a district hospital, much of the time is lost. Now, have you witnessed cases of that nature for us to say that clearly people are suffering because of the lack of facilities in the rural areas?
Yes, as I had mentioned, that most of the places where there is an outbreak of encephalitis are in the remote areas, mostly in the tea gardens in Upper Assam, where these cases are seen. So these people who are affected, probably they think it's a common flu or fever, and they ignore the initial stages which has led to this outbreak. So the lack of awareness on the ground is very less, and the campaigning is also not much by the state government, which has led to this outbreaks. But it is an annual problem, as I mentioned, but the state government needs to think something very solid on this.
All right. Thanks for joining us, Arindam, with the latest inputs.